Hi, everyone. I'm Natalie Shurtleff. I'm the Associate State Director of Advocacy and Outreach with AARP Connecticut. So welcome to another episode of Coffee and Tea with AARP, our biweekly series where we talk about issues important to people 50 plus here in Connecticut. So today, volunteer Howard Garval is joining us with Representative Jillian Gilchrest from West Hartford. So before we get into our questions with Representative Gilchrest, I wanted to give Howard an opportunity to introduce himself. So welcome, Howard.
Yeah, thanks, Natalie. Representative Gilchrest, I'm a retired nonprofit CEO. I was at the Village for Families and Children for 18 years, and then I was at Child and Family Service in Hawaii for 11 and a half years. So nonprofits are dear to my heart. And I've been a volunteer for AARP for 3 years now, mostly involved with advocacy and protecting Social Security. So that's a little bit about me.
Thank you, Howard. And thank you for all you do for AARP and for nonprofits as well. So Representative Gilchrest, welcome. I'll let you share a little bit about yourself as well.
Wonderful. Thank you. And so nice to see you, Howard. And wow, Hawaii, that was a nice switch.
Oh, yeah. Yeah, I came back to West Hartford for our grandchildren and our daughters who are on the East Coast. So we don't regret leaving, but we miss it. We were back in February.
I'm sure.
And we loved it. But we don't regret having moved back because grandchildren and daughters, yeah, really important.
They're lucky to have you here.
Yeah.
So I'm Jillian Gilchrest. I've been the state representative in the 18th district in West Hartford since 2019. And before serving in office, I was an advocate for different nonprofits here in the state of Connecticut, lobbying at the state capitol for predominantly issues that impacted economic security and women's health and safety.
Thank you. Yeah, I think I advocated alongside you a little bit with your advocacy days. All right. So, and I know that you've still been an incredible advocate. One of the important issues that you've been working on this session is lowering the cost of prescription drugs. We know that they can be too expensive for so many people, so many of our seniors. So this year you co-chaired a bipartisan, bicameral prescription drug task force. So can you share a little bit with our viewers about that task force and what you were able to come up with?
Yes, this was a great opportunity and a learning experience for me. I served with my co-chair on the Human Services Committee, Senator Matt Lesser, and then Senator Gordon and Representative Mara. So as you mentioned, folks from the Senate and the House, Republicans and Democrats. And the working group had people participate in each of the meetings from various backgrounds and expertise. It's been interesting because, yes, we learned a lot. Another thing I learned, though, there's a lot of finger pointing. And so right now, as we move into what can we actually get across the finish line in terms of policy, there's a lot of issues in terms of drug manufacturers and the costs, right? And then the insurance companies have a piece, and then the PBMs. And trying to come up with a policy that addresses each of those areas and not putting the blame on any one entity, I think is important. In an ideal world, it'd be great if we could just, right, like lower the prices. But in a capitalist society, folks are now connected to the profit associated with each of those pieces. And so that's kind of what we're weighing through. For myself, I co-chaired the PBM subcommittee of the working group. And so learned quite a bit about what that world looks like, policies that have been implemented in other states, how they've worked, how they haven't worked, and what we can potentially do here in Connecticut to bring down those prices. Because at the end of the day, it's kind of trying to sift through all of that, right, to get to the heart of the matter, which is folks cannot afford their prescription drugs. And we have people in Connecticut who are either going without and then having serious health consequences, or cutting down the amount they're taking, which is not what was prescribed to them. And again, not safe. So I think if we can keep that as our North Star, and at the forefront of every conversation about this policy, we'll be able to get somewhere good.
Definitely.
Representative Gilchrist, PBMs are pharmacy benefit managers. Is that what they stand for?
Yes, thank you for, yes.
No, no,
Benefit
I,
managers.
I know about them, but that's what I thought they stood for. What was it? Do you know what it was like before there were such things?
Great question.
How did they manage without them? I mean,
Well, interestingly, these like stats will be thrown out, and we're the only country with pharmacy benefit managers.
okay.
But then the pharmacy benefit managers will tell you, well, that's the case because we're one of the only countries that at the federal level doesn't cap the price of drugs.
Oh,
And so this middleman, which I feel
right.
like everyone is okay calling them because they are, this middleman, the PBM, came to both try and get the price down for the business, the consumer, the individual who owns the health insurance, but they don't need, but again, capitalist society, they need to make a profit. And so now they have built in these profits to that role.
Right.
And then what we've seen in not just Connecticut, but other states is that insurance companies own PBMs.
Yeah.
And so it's also parsing through, well, how can the pharmacy benefit manager be acting in good faith for the consumer if they're connected to the insurance company?
Yeah.
In a state, though, that is fondly called the insurance capital of the world. So there's a lot of layers to this issue.
Very tricky.
Yes.
Yep. Wow.
Great.
Yeah, but AARP has been very involved with this issue, trying to lower prescription drug costs. And I know 3 years I've been involved. I've been really impressed with AARP Connecticut and its effectiveness in terms of getting legislation passed that helps seniors, but also end up often helping a lot of everyone else too. So, yeah.
Yes, and the advocacy and the research out of AARP, they're such a helpful partner in letting us know what's going on in other states, what's works, what hasn't worked, and where we can move forward. So yes, been so instrumental in this work and participated in the work group.
Yeah, that's right. Yeah.
Yeah, as we're approaching the end of the legislative session, I know there's a lot of discussion that came out of the task force. Can you tell us a little bit about some of the legislation that's still moving forward and what it would do?
Yes, so there's 3 separate bills. In the end, there will only be one. There's a Senate bill, a House bill, and a governor's bill. And so behind the scenes, legislators have been meeting with the governor's staff to try and come to an agreement on what could be in a final package. And so looking at some transparency with pharmacy benefit managers, because the more information we have on kind of what that profit is linked to, and trying to get them more in line of getting the best net price for the consumer, because there's all these rebates and how does the rebate come into play? So we really just, again, back to that North Star, how do we ensure that the consumer at the end of the day is getting the best price drug? We're also looking still, which in this current federal climate might seem odd to folks, but still looking at how could we get drugs from Canada? And also there's now a proposal on the table to do a virtual price linked to what's being offered in Canada. So if we actually can't get the drugs in from Canada, can we match our price to what is being distributed in Canada? And so that's a positive. So those are some of the big ones still on the table. I'm trying to think, there's a few more, but those are the ones that come to mind.
Great. Well, during the legislative session, AARP volunteers and myself included, we're out there. We show up in Hartford in our red shirts, the Red Army, if you will, to advocate on these important issues. What can you tell our listeners about how they can make their voices heard? Because probably for many, it's a little bit of a mysterious process, the whole legislative process.
Yes, thank you, Howard, for that. And I'm sure in your experience, what you've realized is we're here for you. Your elected officials are elected to, I mean, the word itself, represent you. And so we need to hear from you to understand how you're being impacted by the issues that we are attempting to pass policies to address. And so legislators, Outreach is best in many different ways, but whatever's most comfortable for you too. So email works great. At these days, we're with our computers constantly in the chamber and at home. And so sending an email. We get a lot of mass-produced emails, which is fine and great. If it's from a constituent, we read them. But if you want to take kind of the email that maybe AARP sends you, like, hey, here are the issues we're working on, and just tailor it to how it impacts you, it actually goes a little farther, because then we know that it's really your voice and you're sharing how you're directly impacted. You can also call our offices, and you can also ask to meet for coffee in town or at my office at the legislature. We meet with our constituents in person. You can certainly come to the legislature and see kind of us in action and speak with us. I think it's really neat, but I I love this world, but coming up and seeing kind of how the process works, I think is really interesting. And again, makes it less abstract. This is something you can participate in and have the right to participate in.
Exactly. Those are really good suggestions. I've heard like form letters are really not the best way to go. That either a personal email but you particularly highlighted telling your story, how it affects you in terms of particular legislation that AARP might be advocating for. And I remember that when I was advocating at the legislature, and especially in Hawaii, we brought people in who could tell their story about how they were affected by something, and legislators really paid attention to that.
Yeah. I thought of another piece of the drug bill, and this connects to the advocacy that we're working on, is the rising cost of generic drugs. And some pushback from folks who don't want to see us maybe pass this policy is, show us the data. Where is that? We haven't heard about that. Generic prices aren't rising. So it's a perfect example. If there's someone for whom has taken a generic drug and it is increasing, that's something you could share, and it would be helpful as legislators, because then we could point to that experience to say, well, I know I met with so-and-so and they've been on this drug for this many years, and in the last 2 years, it's gone up XYZ. And so that's the information we need to better inform how we argue for or against a policy.
Yeah, it's a great example, and the importance of having data for legislators, like clear data to back up what you're saying about issues or why something's important is really a good one.
Great, thank you.
So I know we talked about a lot about the prescription drugs and that issue that you've been working on this year, but you do serve as the chair of the Human Services Committee. So are there any other priorities that you've been working on this year that you'd like to talk about?
Sure. My top priority has been Connecticut's Medicaid program. And we've been hearing a lot about Medicaid, again, at the national level, but here in Connecticut, it's also an incredibly important topic we've been talking about for a few years, because Connecticut has some of the lowest Medicaid rates in the country. The rates are the amount we pay the provider for care. And some of our rates are as old as 1998, which is mind-blowing. A large majority of the rates are from 2007, which is still mind-blowing. And so we are not paying our providers the true cost of care. And not only is that impacting the workforce, we're seeing different providers close, or it being very hard for folks to hire people for these jobs. We're also seeing access to care being impacted, because when you don't have the providers, folks can't provide the care. Also, with the reimbursement, the rate being so low, providers are limiting the amount of Medicaid patients they take in a given month or a given year. And so that limits access. So we're trying to push by the end of the session for a significant investment in the Medicaid program. This also links to what's going on federally, because we don't know, right? It kind of goes back and forth. If you're following the news, some days they're going to cut the Medicaid program entirely. Other days they realize that would impact way too many people. We do anticipate something happening federally that will negatively impact our Medicaid program. But we can't just sit back and wait when at the state level, we already know we need to do something to improve the program. So the Appropriations Committee budget did invest 15 million. We're pushing for 30 million in fiscal year 26 to really get those rates up and get us in a good place going into whatever happens next. And I'll just say, you know, there's a lot of misinformation, in particular coming out of Washington about Medicaid. But in the state of Connecticut, nearly 1 million residents receive their health care and services through Medicaid. And 40% of our state Medicaid budget is spent on those who are aging and those who are disabled. So oftentimes it's thought of as, you know, this is for poor people. And then you hear negative things that people are just kind of, you know, living off the system. But the majority of folks who can work, who receive Medicaid. And then, like I said, we're talking about folks with disabilities, our aging adults. And so it's an important program to invest in.
Yeah, I mean, for us at AARP, obviously, you know, we focus a lot on older adults, and there are so many of our members that are dependent on Medicaid, either in tandem with Medicare once they reach Medicare eligibility, or some of our 50 plus members that haven't reached Medicare age, that Medicaid is the only way that they can get health care, and it's so important for them.
Agreed.
Yeah. Yeah, you know, the nursing homes, I mean, that's, you know, that's a whole area that I think a lot of people probably don't even know that often Medicaid is the primary payer often for nursing homes and for the residents in nursing homes.
Yep.
I went through that with my mom years ago where, you know, we had to apply for Medicaid because she spent down her assets and she needed nursing home care. And I think the general public may not realize how many seniors and older adults, you know, that's the lifeline for them in terms of getting their health care at the end of life.
I'm so glad you raised that because I couldn't agree more. I think most people don't realize how large a role Medicaid plays in nursing homes. And then in addition to home care, to services that keep folks to be able to live in their home so that they don't have to go to a nursing home if they so choose. And so it's vitally important that we invest in those programs for folks.
Absolutely. Absolutely. Yeah, and I know another priority, Natalie, for AARP, a big one, is caregiver support, because, you know, all of us would prefer to live in our own home if we can as we age. And a lot of the caregivers are family members, often women, and sometimes they have to leave their jobs, sometimes they have to reduce their hours. So there's an economic impact, not to mention the challenges of an ailing parent that they might be caring for in their own home. And often they have children of their own. So you got that sandwich generation issue as well that they have to manage. We don't do enough for caregivers in this country.
No, we don't. You're so right. It's such hard work. It's so needed. And if only thinking about budget, which I wish we weren't, but oftentimes comes down to we're saving in the long term on folks needing to go into nursing homes. So we invest in the caregiving. It actually saves the state.
Having been in a nonprofit organizations that ran residential programs, they are the most expensive level of care.
Yep.
And they have to be there for many different populations. But if you can do something in the community that prevents residential care, it's going to be a lot less expensive and a better outcome for those people who don't have to go into residential.
Yes, agreed.
It's true with children too.
Yeah. And I didn't say I made the quip about Hawaii, probably because my brother lived there too, and still fondly. But thank you so much for your work in nonprofits.
Thank yes.
You. It's
well,
important work.
It's been my career. Yep. Well, is there anything else? Go ahead, Natalie.
You go ahead.
Is there anything else, Representative Gilchrest, you'd like to share that's important to you or just for our listeners?
Some other areas we're looking to improve upon are our services for those with intellectual and developmental disabilities, those with profound autism.
Mm,
Also, we have some legislation that would address wheelchair users.
mm,
So just really trying to build off work done in previous sessions, but also continue to improve upon the social service system here in the state of Connecticut.
yeah, that's great. That's great.
Thanks.
Well,
Yeah.
thank you so much for both of you for joining us today, Representative Gilchrest, Howard, and thank you to all of our viewers, Coffee and Tea with AARP. And join us again in 2 weeks. We'll have another episode right here on our Facebook page and on our YouTube page. And you can always view our back episodes as well. So before we go, make sure you scan this QR code so you can join Howard and our many other advocates in advocating for important policies here in Connecticut. So thank you, everyone.